everyone, my name is Melanie Grant and this is C&M Glass. Today's topic we're looking at for ICD-10-CM on Chapter 19 of the ICD-10-CM Coding Book, Injuries, Poisonings, and certain other conditions of external causes. And this is part one of two parts where we'll be looking at this coding chapter. Our key points today will be looking at traumatic injuries, talking about fractures and wounds, and status of care, where we'll talk about the different types of initial, subsequent, sequela, and healing visits. So let's get started. The first thing I want to point out is that we will be using the 2019 expert edition of the ICD-10-CM Code Book published by the AAPC. We'll also be referencing the textbook that is used for the class I'm teaching this video with, which is the Let's Code It 2019 edition from McGraw-Hill. So we're looking at sections 16.1 through 16.3 of the textbook and focusing mostly on 16.2 and 3. In this particular chapter for coding, the important thing to look at is that the patient has had some sort of impact that it caused them injury. And so the title of this being injury, we want to keep in mind that there's different types of conditions or diagnoses where a patient is seen for something such as a fracture that is not caused by an impact of an injury. So the thing to keep in mind is the first and foremost, all injuries for this chapter are considered traumatic. And when we say the word traumatic, we're talking about the word trauma. Okay, if we look at the word traumatic, we say it's pertaining to some sort of trauma. We don't think about mental trauma, but physical trauma. Anything that causes the body harm is considered a trauma of some sort. Whether it is a bruise on the hand because they hit their hand up against a desk of some sort, or whether it is a crushing injury where it was severely traumatized. So you want to make sure that you have the correct definition in your head of what is a traumatic injury. Now, with fractures, there's two different types. There's traumatic fractures and there's pathological fractures. So it's important to identify a pathological is going to be a condition, if you remember the term patho, meaning disease, it is going to be a condition of a disease. And so pathological such as osteoarthritis can cause fractures from normal activities. Those are not considered traumas. Those are considered a condition of a disease. And those would fall under pathological fractures and coded to the musculoskeletal section. For today, we're looking just at traumatic injuries for fractures and wounds. Now, the first thing you want to do is you want to refresh yourself on the different types of fractures. Okay, so we have in our textbook a really nice diagram on figure 16.1 that shows us the difference between terminology such as complex, incomplete, commuted, green stick, simple or closed, compound or open, collars, and impacted. Okay, so some easy ways to remember this. It's important to identify the type of fracture because you're going to be looking at the type of fracture when you're looking at the fracture itself in your coding book. But it's also important to remember what type of fractures are. So you'll notice that for a simple fracture, now we never assume anything. We always remember our golden rule. If it's not documented, it didn't happen. But on something that's documented as simple, it should be identified that this is, well, easy enough to identify that it's closed. And in fact, if a fracture is not documented as open, we should go to the default of saying it's closed because it's not documented that the wound itself was open. An important note to keep in mind, if the fracture treatment requires the provider to open the skin to repair the fracture itself is still a closed fracture that they then opened surgically. So when you're looking at the type of diagnosis, the fracture was still closed if the skin was not broken. However, for some fractures, such as a compound fracture, you'll notice that they have an abbreviation, the term open. And that's because in order for the definition of a compound fracture to apply, the skin is broken and the fracture or the bone is jutting out. That is considered a compound fracture. And so for those two, they have an automatic default of either closed or open. It is important that the provider state whether or not a fracture is open or closed, and there may be policies in offices that you work at that will say how to handle that if the provider does not state it. But keep in mind, the automatic default is less is more. If they didn't document it, it didn't happen as more, or it didn't happen as something more. So the less information you have is the most that you can give. And that means that we give closed for our type. Now, different types of fractures will also identify sometimes the location of the actual fracture itself, such as the bone, because it can only happen in a specific type of location. And as always, if you're not sure, look it up. This is especially important in this area of coding because a lot of your terminology is giving you the information you need in order to code that procedure. And I guarantee you a provider is not happy to receive queries where they're being asked, where is the bone location for this fracture, when they're saying it's terminology in the actual definition. And so you want to keep in mind that if you need additional detail, it's often found by understanding the type of fracture. And so it's important that we understand that we look that information up. Now, when we're talking about coding the location of a fracture, we want to know multiple things. What bone was broken, not just the arm, but which of the 3 bones in the arm? What part of that bone? If it's the upper end, the lower end, the shaft, all of those things are important. And of course, in extremities, what side of the body that was on. Okay, so you're going to need to identify all of that from your note, whether or not it was open or closed, and of course, displaced, which means is the fracture a clean fracture or did it become displaced? And in some cases, again, the type of fracture is going to tell you if it is displaced, because it could not be, if it applies or not. So you want to keep that in mind. You have some great definitions in your text, and it's important that you read through those and make sure you understand the different types of fractures. Okay, so we have an example here, a zygomatic fracture, unspecified site, initial encounter for closed fracture. And it gives us code S02402A. So let's look at that for a second on how these work. S02.402A is a zygomatic, if you remember your bones, that's your cheekbones, fracture of an unspecified side. Ooh, an initial encounter for closed fracture. So let's look at that code S02. First and foremost, anytime you look up a code, you want to look at the chapter information. For chapter 19 in the ICD-10-CM Code Book, that's found on page 975. And the chapter 19 does have notes indicating that you should use secondary codes from chapter 20 for external causes of morbidity to indicate the cause of an injury. Codes with the T section that include an external cause do not require an additional external cause. It also says use additional code to identify any retained body if applicable with a Z code, and it gives you an example. And it says that our injury codes here excludes birth traumas and obstetric trauma, because birth and obstetric is going to be found in the genital urinary section. For maternal conditions, you want to look there instead. So that applies to everything in this chapter from S00, I'll write that up on the board, through T88. Okay, so keep that in mind. And the chapter blocks for S02, there's several in here. There's injuries to the head, neck, thoracic, abdomen, shoulder, elbow, so on and so forth. It goes pretty much into every single part of the body, multiple body regions, and unspecified body regions. And then you also have your T codes, which identify effects of foreign bodies, burns, frostbites, poisonings, toxic effects, other unspecified effects of external causes, early complications of trauma, and complications of surgical and medical trauma. There's also an additional note at the end of your chapter blocks that states the use of S section for coding different types of injuries related to single body regions and the T section to cover injuries of unspecified body regions, as well as poisonings and certain other consequences of external causes. So it's giving you a little bit of example. What that says in real terms, the S codes are used for injuries and the T codes are used primarily for unspecified body regions and or drugs and chemicals. So today we're talking just about those S codes when we're talking about our injuries to the body. And when we go to S02, that's going to be found in block S00 through S09, which is injuries to the head. So if you remember, the zygomatics are the cheekbones. Those are in the head, so that's correct. At the beginning of this section, there is some includes notes as well as excludes. So always look at the block that your code is in before you go to the category. In the includes notes, it indicates some of the includes, which include face, which this is part of. It also tells us to code for any associated infections, but it excludes anything from burns and effects of foreign bodies. And so if your condition includes a foreign body or is from a burn, you would not code from this section, you would go to that section instead. So next I can go to S02, which I'll find a couple of pages over on page 978. And again, don't go to the direct code that you think you have. It's important to start at the category. This is especially important in this chapter because we're going to talk about the status of care next and where to find that. In this case, S02, fracture of skull and facial bones, does apply to zygomatics. There is a note. A fracture not indicated as open or closed should be coded to closed. And so, as I mentioned earlier, sometimes there will be specifics that will change depending on the location. This one says if it doesn't tell you, code it as closed. Also, the appropriate seventh character is to be added to each code from category S02. And it gives us codes for A through S, A, B, D, G, K, and S. Okay, now this is important. Why? Well, number one, when you're looking at some of your fractures, a 7th-digit character is going to indicate whether this is the patient's initial period of care, whether it's the subsequent after care has been started, or whether it's in the healing process, or whether or not there's a condition that's caused as a late effect or sequela. Now, with these codes, these change depending on the different types of injuries, and because of that, different categories will have their own 7th-digit character. And unlike everything you've seen so far, where the characters are listed as S02, then S02.4, S02.40, the 7th-digit character will only be indicated with a symbol indicating there's a 7th digit. And so we'll just kind of make a little example of what that looks like here. And in that symbol, it's not going to show you the 7th digit next to the code. You instead have to go and find that. And so you'll see this little 7th character here. Nice little squeeze. I don't think that showed up on the video. Let's see here. Just imagine it shows a 7th. There you go. You can kind of see it there. So you can see the little symbol that says 7th, meaning that there's a 7th character required, but it's not going to tell you what that is. So it's your job to go back to the category and find that box that we're looking at right now, indicating the appropriate 7th character for category S02. Now, pay close attention to this because some books are designed where it has the category for multiples. So it'll say this box for S00 through S05, whereas others will have it listed each time. So you want to pay attention to that box. Don't just automatically go to the closest one. You can get it very wrong and you can get your code rejected because of that. Okay, so we look at the 7th digit character and we have initial for closed fracture versus B is initial for open. Okay. D is subsequent with routine encounter for fracture with routine healing, meaning that in routine healing there's no problems that are noted. Okay, I'm going to switch my marker out here. My G is a subsequent with delayed healing, okay? So when we say subsequent, again, we're talking about each visit that the patient is coming in after their initial period has started, after the initial care. And when we talk about delayed healing, that means that it's not healing as expected. It's taking longer, and it's documented in the note as that. Our K, though, is also a subsequent. This one's a little bit worse. This is a non-union, meaning that it's beyond delayed healing, but the bones themselves are not fusing the way that they are supposed to. And so sometimes additional intervention is required here. And then our S is sequela, meaning that the injury is a late effect of the fracture itself. So they're being seen for something that was caused as a result of this fracture. And oftentimes when you have the S for sequela with an injury, there may be another condition, such as arthritis caused by an initial injury, and you'll have the condition followed by the fracture as a sequela, followed by any additional codes that apply. Okay, so I'm going to turn the bright up just a little bit here. Our seventh character might disappear on you. If that happens, don't worry about it. Okay, so in this case, zygomatic fracture, unspecified site, initial encounter for closed fracture. We found S02, and our next one was 4. Always read up and down, so keeping in mind that it was the cheekbones, and so we're going to look at the different options. We have base of the skull on dot 1, and everything that follows we don't need to read because it's not the base of the skull. We have nasal bones for dot 2, orbital floor for dot 3. If you remember orbital, you're going to remember that's around the eye. Malar, maxillary, and zygoma bones. Okay, so this is talking about all of this area right here. You have your malar, maxillary, and zygomatics. Okay, and it gives us some examples: fracture of superior maxillae, fracture of upper jaw bone, and fracture of zygomatic process of temporal bone, and the temporal being back here. Okay, so yes, S02.4 is correct. S02.40 includes the breakdown within that of the fracture of malar, maxillary, and zygoma bones unspecified. And so when you see something like that, always verify, was it specified further? Well, dot 4.1 is Lefort fracture, so there's a type of fracture. Dot 4.2 is alveolus of maxilla, and there's nothing beyond that. So yes, it would be under dot 4.0. Under 4.0, we have the options for 4.0.0 through 4.0F, and we have malar fractures, maxillary, zygomatics, and all of those being unspecified, and then we repeat those with right and left specified. So we remember again our location, what side. It wasn't given to us, so we go with zygomatic unspecified side 402. Now A is determined by going back to that little box that we saw under category S02, because there's that 7th digit character required next to S02.402. We go to that and we find initial for closed and fracture. And even though it's not stated as closed, we know that the default is closed. Okay? So let's move on, and we'll look next at some of our different types of wounds. If you have questions about fractures, there's some really great information. My biggest advice is to read up on the different types of fractures. This is going to help you the most, and take your time with this category, because when you're looking at all the very specific details, and it is very detailed, it's okay to take a little bit of time to ensure you have the right code rather than getting the wrong code and having denials later. So always pay attention to what you're looking at there. Now for our wounds, and I'm just going to delete some of this here to make a little more room. We'll leave the rest of it up. With our wound types of injuries, we're looking at various different types from very non-traumatic, why are you in the office kind of thing, to very serious conditions. And so we have a couple different types and some terminology you should be aware of. Number one, and one of the most common errors that I see, is the difference between laceration and lesion, okay? So let's talk about that for a second. A laceration is a cut to the skin, and it's considered superficial. Superficial being another terminology for skin. Okay? So you don't want to think about level of importance rather than just remember that a laceration is a cut or an open wound. The term itself indicates that this is open, and most of your wounds will be, although there will be certain ones, and again, look up all terms that you don't know. So a laceration to the skin versus a lesion. Now a lesion is going to be an integumentary system. A laceration is an injury. A lesion is something that is a growth of some sort, whereas a laceration is a cut of some sort. Okay? So when we're talking about injuries, always keep in mind the difference between the two. They're both of the skin. They're typically both superficial, although some lesions can also be in other body areas and completely within the body. So when we're talking about skin ones, the lesions are typically superficial, but there's others out there. When we're talking about traumatic injuries, though, the term is laceration. And these two can look very similar if you're not familiar with them. It's very easy to get it mixed up. And trust me, even experienced coders can do this. So just be aware of that as you're coding. Contusions and hematomas. So we already know what a contusion is. And you may not think about it, but a bruise is a contusion. Okay? And a hematoma is kind of like a bruise, but it's a pocket of blood. So a lot of times a patient may have a hematoma in their skull where blood is just kind of starting to fill up like a bruise would. And that can cause some very serious consequences. But those are both going to be categorized very similar. Then you have puncture wounds. Okay, so you want to remember a puncture is something of a stabbing, something where something has gone into the skin and out. There may or may not be additional foreign body with that. Okay, so you have puncture. Almost forgot my little C there. Okay, you have avulsions, and this is going to be where multiple levels of the skin has had some sort of tear away or has been ripped off. So unlike a laceration, which is more of a cut, an avulsion is going to be like a rip. And it's much more serious. And then, not to be confused with punctures, you have animals, insects, and human bites. Okay, so this one is its own entity. And so those are all going to be different types of traumatic wounds to the skin, and those are separate. Now, before we go much further, I also want to mention some of the injuries to the muscles themselves because they fall similar with fractures, and we don't have them listed. You have the difference of strain versus sprain. Contusion is listed again because a contusion can be listed under muscle, and so I wanted to kind of identify the difference here. One is of the skin and one is of the muscle, depending on how deep it goes. You have tears, and again, you want to pay attention to what is the layer. So you have of the layers of the skin versus of the muscle. And then you have myalgias, which is just muscle pains. That would not be coded here. And ruptures. Okay, and so this is typically something more serious where an organ or tissue has ruptured from the injury itself. So you can have a traumatic rupture happen after an accident, for example, a motor vehicle accident. Okay, so those are important to identify here, just to identify what are we talking about? Are we in a wound or are we in a muscle injury? And paying attention, again, to the location of the types of injuries is extremely important. Okay, so let's go ahead and code a scenario together. When we're looking at our wounds and we want to look up injury coding, unlike with fractures, we're going to look under injury as our main term. You want to remember that you may find some of the terms such as contusion or hematoma by itself. You may also find injury to the location that it's at, and that can be a lot easier sometimes when you're looking at coding in your alphabetical. Okay, now here I have a scenario, and I'm going to clean the board so we can do it together. We're going to code for just the injury itself, although if you'd like on your own to code the additional external causes, feel free to, because they're fun and can have some interesting pieces that you weren't aware was there. Okay, so I almost have the board cleared. And trust me, it looks a lot dirtier on my side than on yours. Okay, so here we have our patient, Nathan Kirchner, an 8-year-old male, was hiking in a public park with his Boy Scout troop. When they came to a clearing, he saw a fowl and its mother looking over a fence in a corral in the northeast edge of the park. Wow, that's pretty detailed. So he saw a horse and its baby. He reached out, because he's 8, he would do this. My son definitely would. He reached out his left hand to pet the fowl, and the mother horse bit his thumb. His scout leader took him to the emergency room. After examination and some tests, Dr. Clifton cleaned the wound, and applied a sterile dressing and gave him an antibiotic. Okay, so from this, we have to identify that he has an injury. Okay? What type of injury is this? Now, it didn't say a cutting injury such as a laceration. It was definitely an open injury because they're talking about it. In this case, the horse bit him. And so we're going to say horse bit thumb. Or okay. I used to love having classrooms where I could teach in person and I could spell things correctly on purpose, so I never got caught when I started spelling it wrong. So yes, I started to write a horse throat instead of a horse, the animal. Okay, so our injury here is that the horse bit the thumb. Okay, so we have some information. We have what type of wound. It's a bite. Oh, speaking of misspellings. We have a bite is the type of injury. The location is the thumb. Do we know what thumb it is? If we go back here and say what hand he lifted his left hand. So even though they didn't say which thumb, they said which hand was injured, and we can take that as appropriate documentation. Okay, so we want to remember this is an injury. With a horse bite, this is an open wound. Okay, and it's not specified as a type of wound, just that it's a wound. Okay, so we're going to go in here, and remember in your alphabetical, you're going to look up injury, and you can look up bite or even wound for this one. Okay? So I always put multiple terms in my head. And I'll notice that bite actually does not have a listing. And so I'm going to keep going. I also notice that I can go off of an anatomical location, and since I have thumb, keep these in your head. As you're going through your coding, always run through all the different areas that you might find this under. Okay, so I'm looking at injury and this is categorized mostly by location, some of them by the type, and so I'm thinking, okay, it's a bite, but bite wasn't in there. I'm thinking, okay, it's the thumb, it's a wound. So I'm going to look for both of those next. And I'm going to flip a few pages. Okay. And I find thumb on page 227, which is my alphabetical index in my ICD-10-CM first table, about halfway down. And the code that it gives me is going to be S60.93. Let me grab a different color pen here. And it has a little symbol next to it with a check mark. Okay? And that means an additional character is required. So when I look at this, I also see a breakdown of additional information. So even though S60.93 is perfect for an injury to the thumb, if it's an abrasion, it wants me to go to abrasion. If it's a bite, it wants me to actually get out of injury and go into bite. So I just love it when they do that. And they change it depending on the particular book sometimes. So different editions may have it in different areas. So in 2018, it may have done the same thing, but maybe in 2017, it used to be elsewhere. They also list blister contusions, foreign bodies, and other options. So for me, here I know, even though thumb S60.93 something is appropriate for a wound, I have a more detailed description, which is bite, superficial, thumb. And so I'm going to now go into my alphabetical and find bite, superficial, thumb, just in that order as it gave me. Okay? So I might have thought bite of the thumb and it would have taken me to a different area or maybe even given me backlash. In this case, it wants me to go bite, superficial. Again, remember that that means the skin of the thumb. And we know it's of the skin that it's superficial because it didn't specify that it was deeper. And the treatment didn't seem like it was either. Okay, so I flipped over to page 74 of my alphabetical. I'm under bite. I found superficial. I'm in the third column. Superficial. See bite by sight. Oh, I love it when they do that. So even though it told me see bite superficial by thumb, sometimes they forget how they put it too. So we're going to continue to look for thumb, which is on the next page, 75, in the first column. Bite, thumb, S61.05 check mark, or bite thumb with, and it gives me damage to the nail. It gives me bite thumb superficial, not elsewhere classified, S60.37, and insect. So I'm going to write 3 codes here. I have the first one that we found, which was injury to the thumb. I have the next one, which is bite to the thumb, S61.05 check mark. And I have the third one, which is superficial, not elsewhere classified, S60.37 check mark. Okay. So there's 3 options that the alphabetical gave me. This is a perfect example of what coding is really like because you're going to have terminology from a description that doesn't exactly match how the code book works. And you want to look at all of the options that you might have. You'll notice that these 2 categories are listed twice. And so when I see that, I just say, okay, S60 and glance at S61. See which one's the better one. Because at the end of the day, you want to read up and down anyways. The idea of the alphabetical is to give you direction on where to go so that you can get to the right area. So for me, I'm going to flip over to my injury and poisoning and certain other consequences of external causes, chapter 19 of the coding book, not the textbook. And I'm going to go to the very beginning of that. I want to make sure I look at the beginning of the chapter. I already did this when we looked at zygomatics, but if this was the first time I'm coding for this condition, I would come here, check out my notes, check out my exclusions, and look at S60 and S61 to see what block they fall under, because that might give me information. So I'm on page 975 of my coding book, and the block for S60 and S61 both fall to the same area. Injuries to the wrist, hand, and fingers, which the thumb is part of. And so I know that both of these are going to be in the same block. I'm going to go to the beginning of that block, which is S60, and also where I would have been going anyways. Okay? So the first thing I want to do is I want to look at the block. The second thing I want to do is I want to compare the two category codes that I pulled up to see which one is more appropriate. So I'm going to find the block at the beginning of S60, which is found on page 1043 at the bottom in the left column. There is an excludes to note here, so it's important that I look at that block. So for codes that are S60 through S69, this excludes burns and corrosions, frostbites, and insect bites or stingings if venomous. I already know that it's not going to be any of those, so I can continue. And again, my next step is to look at my category codes first. I had two that I found, so I'm going to look at those before I look at anything else. And I'm going to compare. S60 applies to superficial injuries of wrist, hands, and fingers, whereas S61 refers to open wounds of wrist, hands, and fingers. In this case, because the wound itself was open from the bite, S61 is going to be more appropriate than S60. And so I'm going to take these off of my list and say that most likely my code is going to be S60.05 something and continue from there. Now, I noticed that it also says to code additional wound infections if they apply, and it excludes any open fractures or traumatic amputations. There is an appropriate 7th-digit character for initial, subsequent, and sequela. Okay, so I know it's going to be either A, D, or S. And these definitions don't change, only which ones apply do. So I have S60.0 is wound of the thumb without damage to the nail. I look back at my notes and it didn't say anything about a nail. So, golden rule. If it's not documented, it didn't happen. If there's no information saying there was a wound to the nail or damage, then it didn't happen. So that would seem appropriate. And it falls along the code that I picked up earlier. I am, however, going to glance at some of the others to make sure there's no other information that's more appropriate. So S61.1 is with damage to the nail. 1.2 starts on fingers. 1.3 is other fingers, also fingers, so with and without damage to the nail. S61.4 is open wounds of hand, not the thumb or fingers, because we already listed that. S61.5 is wrist, and that's it. So I know that S61.0 is appropriate. And now I'm going to come in and verify the next character. So I have the first four. The fifth character is suggested to be the 5. Okay. So I'm going to go to S60.0. I'm sorry, S61.0. Now I'm throwing everybody off. Okay, so going back to S61.0, we have unspecified open wound of thumb without damage. We have laceration with foreign body of thumb. We have laceration of foreign body of thumb without damage. We have puncture wound without foreign body. We have puncture wound with foreign body. We have open bite of thumb without damage to nail. Okay, so even though it was the last one, it is the one that was suggested. I might have originally gone with laceration or open wound, but it's important to always read up and down because that identified that 05 was appropriate. Now, the next one, it does have a 6th character. There is a note here. It says bite of thumb, not otherwise specified. So if it was specified as a laceration or something with a foreign body, you would want to look at that. It excludes superficial bite of thumb, C codes S60s. So I would look back at my note and say, did it indicate that the wound was open? When they're doing they cleaned out the wound and applied sterile dressing and antibiotics. So this would be an open wound. So I would stay here, not under superficial. Okay. In the instance you have maybe a toddler who's crying a lot because of a bite and the skin's not broken, you may go to there. So S61.05 has the difference between the right, left, and unspecified thumb. We identified that it was the left, and so we're going to be looking at S61.052, and then our 7th character is required. Okay, so we're going to look, is this the initial, a subsequent, or sequela encounter? And in this case, it is the initial. And so we have our code S61.052. And if you would like to code the external causes, that would be something that we would do with coding chapter 20, but you would have a cause